State well-being official Dr. Howard A. Zucker told the New York Times authorities were examining the condition. A week ago, Dr. Maria Van Kerkhove, an irresistible infection disease transmission expert who works for the World Health Organization, told correspondents at a press preparation, "There are some ongoing and common portrayals of kids in some European nations that have had this incendiary condition, which is like the Kawasaki disorder, however it is by all accounts exceptionally uncommon." What is Kawasaki ailment? Kawasaki malady is described by irritation in the coronary causes and other veins. It generally influences kids around the age of 2, however has additionally been found in certain teenagers, as indicated by the American Heart Association. Albeit all youngsters are in danger, it is generally basic in those of Japanese and Asian drop. Most kids with Kawasaki sickness completely recuperate, yet dire clinical treatment is expected to forestall noteworthy heart issues. Otherwise called Kawasaki condition or mucocutaneous lymph hub disorder, side effects incorporate a fever, rash, swollen hands and feet, red and aggravated eyes, swollen lymph organs in the neck, and disturbed and kindled mouth, lips, and throat, the U.S. Habitats for Disease Control states. In the multi-framework fiery condition patients in New York City, all had encountered a fever, and over half had a rash, stomach agony, regurgitating, or the runs. Not exactly half had issues with their respiratory framework. Daskalakis said if pediatricians speculate a patient has the secretive fiery condition, they ought to quickly be alluded to an expert in pediatric irresistible infection, rheumatology, as well as basic consideration. Early finding and treatment of patients meeting full or halfway standards for Kawasaki sickness is basic to forestalling end organ harm and other long-haul intricacies, he said. The cases were recognized after the NYC Health Department reached pediatric serious consideration units between April 29 and May 3. The patients required heart or potentially respiratory help. The alarm comes after the disorder was accounted for in kids in the UK. Daskalakis said cases were recognized somewhere else in the US, yet didn't determine an area. In New York City, 4 patients tried positive for the coronavirus that causes COVID-19, 10 were negative, and 1 was vague at that point tried negative. Social insurance laborers discovered antibodies against the coronavirus in 6 patients who tried negative for the bug. Daskalakis said that the patient's conditions differed relying upon which organ framework was influenced, however included highlights of Kawasaki infection and stun. He stated, the full range of sickness isn't yet known. State Wellbeing Magistrate Dr. Howard A. Zucker told the New York Times authorities were researching the disorder. A week ago, Dr. Maria Van Kerkhove, an irresistible illness disease transmission specialist who works for the World Health Organization, told journalists at a press preparation, "There are some ongoing and common depictions of youngsters in some European nations that have had this fiery disorder, which is like the Kawasaki condition, however it is by all accounts uncommon." What is Kawasaki illness? Kawasaki infection is described by irritation in the coronary corridors and other veins. It for the most part influences youngsters around the age of 2, however has additionally been found in certain adolescents, as per the American Heart Association. Albeit all kids are in danger, it is generally regular in those of Japanese and Asian plummet. Most youngsters with Kawasaki ailment completely recuperate, however critical clinical treatment is expected to forestall huge heart issues. Otherwise called Kawasaki condition or mucocutaneous lymph hub disorder, side effects incorporate a fever, rash, swollen hands and feet, red and aggravated eyes, swollen lymph organs in the neck, and disturbed and excited mouth, lips, and throat, the U.S. Habitats for Disease Control states. In the multi-framework fiery condition patients in New York City, all had encountered a fever, and over half had a rash, stomach torment, regurgitating, or looseness of the bowels. Not exactly half had issues with their respiratory framework. Daskalakis said if pediatricians presume a patient has the puzzling fiery condition, they ought to promptly be alluded to an expert in pediatric irresistible malady, rheumatology, or potentially basic consideration. Early finding and treatment of patients meeting full or fractional measures for Kawasaki ailment is basic to forestalling end organ harm and other long-haul complexities, he said.